Hi, welcome back. It's always good when people come back. It's a relief, isn't it? So I'm glad you're all feeling relaxed, but good luck with that because we've got a busy day and you're not going to be relaxed for much longer. But it's a good way to start. This morning we're going to start with, before we start the panel, I just wanted to let you know actually that there's going to be a summary of yesterday's small group dialogue at the dialogue this afternoon. So that the UN participants can hear. We're not going to start with that now. I've got a light that tells me that it's working. Yes or no?
Yes.
Okay, so maybe your thing is, yeah? Okay, is that better? Yeah, okay, good. The wrap up from the small groups yesterday will be later this afternoon. So this panel is about ensuring women's agency and participation in humanitarian spaces. I'll introduce you to our panelists as I turn to them with questions. We don't have a lot of time, so we're going to try and not race through, but efficiently move along. So I really wanted to start by setting the scene a little bit, but not too much. And in fact, yesterday, Sanam did a great job, really, of reminding us that pretty much everywhere and in every sector now, there's a universal almost recognition that empowered women really create change. They create strong communities, institutions, and nations. They hasten economic growth, and they improve health and education outcomes. And of course, we know that there's also compelling evidence that the recognition of women's agency and their continued engagement at various stages throughout a conflict and crisis and humanitarian support to peace processes and post-conflict reconstruction is critical to creating sustainable peace. And in fact, the lovely animation yesterday that Sanam showed noted a 54% additional peace dividend when women are actively participating. And my mum used to use the phrase, start as you mean to continue. So we also know that the continuum through crisis and conflict to peace building and post-conflict is such that women's roles and expectations during the conflict will often be mirrored and carried through the subsequent phases. And Nella and Gorana know well from the experience of Bosnia how that looks. That the assumptions and attitudes about the roles of women and the roles they can play in times of crisis result in their efforts being sidelined, and their potential is often marginalised. And so what happens is the roles and capacities, the voice and leadership in crisis actually set the conditions for their participation and leadership in the political economy post-conflict. So Sabina's not the only one with an audience participation moment. This is for you. I wanted to ask all of you if those of you who work formally or informally to build or support women's agency and voice in humanitarian work, development or peace building in any way would please stand up. Really?
No, they asked to repeat the question.
Oh, shall I repeat the question? Oh, sorry, okay. So if you work to build or support women's agency and voice and participation in humanitarian work, development, or peace building, please stand up. Okay? So, if you do so as part of or in support of local or national organisations or groups, please stay standing. Okay? And if you yourself are a member of a local organisation or you personally work on the front lines in providing humanitarian support, feminist advocacy, or experience at the local level, please remain standing. Okay, now, sorry to be, could you just stay standing just for one more minute while I just tell this little story? When I first worked at the UN, which is a very long time ago, I had the pleasure of writing speeches for a very senior UN official. Now, he was a great supporter. Oh, look at all those people who can't stand up for 2 minutes. He was a great supporter of the women's movement and of women's rights, and in fact of feminism. And he had just come back from the Beijing conference. So there you have put me in an age bracket. He'd just come back from the Beijing conference, and he was really enthusiastic. This changed his life. He went on to create a position in the organisation for a person to address the rights of women in program. He went on to create a position in human resources to increase women's role in senior management. He went on to create a group in the organisation to promote women's rights. It really mattered to him. The International Women's Day after the Beijing platform, he was invited to give a speech because he was considered a bit of a mover and shaker, and he was a man on the issue. He was invited to give a speech at the ILO about women's participation. And I wrote the speech for him. It was all about empowerment, blah, blah. And he got up onto the podium and he said those immortal words, "I feel so moved by this subject, I'm going to ignore my formal presentation and speak from the heart." Okay. So he started with the wonderful words, "Women are doubly victimised. First because they are women, refugee women are doubly victimised. First because they are women, and secondly because they're refugees." And we were sitting, the assistants, Sherpas, were sitting in the front, and I don't have a poker face, so what I think goes across here. And he said, he looked down at me, and as he said those words, I went, "Oh." And he realised that maybe that wasn't the right opening. Sorry, you can sit down. But what I wanted to show was, look at all the women who are standing, and the concept that women are doubly refugee women and women are victimised by their womanhood as an opening line at a panel for International Women's Day is rather a striking reflection of how the humanitarian system in those days really saw women. It was almost like the sanctity of victimhood. That the way to understand women and find a role for them in the whole kind of process of humanitarian work was only sort of manageable or comprehensible if you constructed them in this very narrow way of needing our care. I don't know whether was it something about protecting women or caring for them, but it just seemed to me that that very gendered approach was about making us manageable. We can cope if you're always a victim. And yet we know that that's really such a small part of the story, and all the women that were standing are evidence that really, women are frontline responders, they're feminist advocates, they're part of governance structures, they're creating change in those circumstances that has absolutely nothing to do with being a victim. So this session is really about looking at recognising women's agency and continued engagement in the various stages of conflict. And really the goal is to look at more closely how feminist groups are engaging in the humanitarian space and how they can be supported to increase women's agency and participation in the process to bring a feminist agenda to that humanitarian space. So by way of brief introduction, I'd like to start by turning to, there she is, Nisreen. So thank you, Nisreen. Nisreen AlZaraee is a Syrian researcher and consultant. She has a special focus on service delivery, governance, security and justice, particularly looking at the Syrian conflict. And for the past 2 years, she's been the research manager at Tamkeen, which is an organisation that promotes good governance through service delivery in the opposition-held areas of Syria. By way of sort of framing the beginning, Nisreen, could you just tell us a bit about what are some of the challenges and barriers to women's agency and participation in the Syrian conflict? And where are those barriers at sort of the local level and at the national level?
First of all, thank you so much. When we are looking at women participation in Syria at the local level and the national level, it remains inadequate, but not of lack of drive or ambition or actually hard work on the part of women. It's mostly due to external factors on the local level in Syria and outside Syria, whether from governments or donors providing programming for Syria. To start on the local level, we have mainly the security issue. In all parts of Syria, if you are, for example, in opposition-held areas, your mobility is extremely limited by the ongoing airstrikes and attacks by the Syrian regime and their Russian allies. So basically, sometimes the idea of going to your work, most women in Syria, the working women, are in the fields of education and health. Schools and hospitals have been targeted repeatedly by the Russians and the Syrian regime. So basically, just the simple act of going to your work means you are making yourself a target, a moving target. On the opposition, in the opposition areas as well, on the ground, you have all kinds of militias with different ideologies, armed groups, foreign fighters, Syrian fighters. Some of them claim to be moderate. Some of them have radical views. They all have one thing in common. They are not really happy with women participation. If they are religious, they will say it's anti-religion, it's anti-Islamic to be in the street when you are a woman. If they are not religious, it's just the tradition. They revert back to the traditions of the community. And we have to acknowledge that the social fabric in Syria, it has been unraveling over the past 6 years due to the war. So even families, even local relatives of the women, they don't want them to go out because they want women to go back to the home, to be mothers and sisters and wives. They are holding to that traditional role of the womanhood as a way to keep society together. When you leave opposition areas, you have areas under control of ISIS. Basically, there is no possibility of women participation. The only form of women participation is foreign women coming mainly from Europe who are part of a police force to keep especially Syrian women and local women in check. So they are called Al-Khansa group or something. It's a police force, local police force by ISIS, to search women, to beat up women in the street if they are not wearing the proper hijab, the proper niqab. They are a group of women who go around picking wives for ISIS soldiers. So this is the only form of women participation there. We have doctors, we have teachers, but they go do their job and come back home. They can't have any social agency. If you try to say anything out the line, you will be a target, you will be killed immediately. In the regime areas, if you are a woman working in a public space, in anything that's not regime sanctioned, you will be targeted by the secret police and the Syrian army and the foreign militias that exist under the auspice of the regime. If you are working with IDP women, if you are working with the wives of the martyrs killed during the conflict, if you are working with families of people who have disappeared or men who have been detained or disappeared during the war, you are a target by the regime. A woman working in one of the regime-held areas told me that a police officer interrogated her and told her they can't know that their family have support. They can't know that their family have any luxury. They can't know that their family have food on the table. They have to suffer, and he was talking about detainees. So they can't even have the peace of knowing, and we have to know that detainees are undergoing horrendous forms of torture in the Syrian regime prisons. Yet they are denying them the fact, knowing that their wives are getting a bag of bread every week or some blankets for their children. If you leave all these horrendous areas and go to the Kurdish areas, despite all the propaganda about women participation, that women participation is sanctioned within the, under the control of the BYD. If you are not working with them and for them, you are a target. If you are working in the media and covering any of their transgressions, a woman was beaten, a pregnant journalist coming from Iraq Kurdistan, was beaten up by BYG soldiers in front of everyone. And when people protested, like, she is writing against us. And this is supposed to be one of the most progressive groups. If you are working in education, they get really, really frustrated because they want to enforce this multilingual education, which is a great idea. You have education in Syriac, in Arabic, and in Kurdish, but then they didn't have the resources to formulate this kind of educational curriculums in these languages. And when people voice their frustration, like, we need proper education for our children, we can't wait for you to formulate the curriculums, you actually can be detained. Women activists, women who are part of other political groups, they have been deported. Their cars, offices, houses have been burned. There are so many incidents. That, not to talk also about the women and families they have deported from Arabic areas under their control. These transgressions have been documented by Amnesty in a report last year. So basically, security situation, the fact, the act of leaving your house and going out to your work or to your office or to your organization is such a huge risk for most of Syrian women. Then, when we go to the society, people are frustrated. Programming for Syria, any woman from Yemen, Sudan, Iraq would know that. Programming have been a failure. Programming in the development level, education, health. Health is the only thing that's functioning, but still there were so many things that had to be done, and they haven't. So basically, there were failure in programming, and for local people on the local level, they are afraid of the shelling, they are afraid of the radical armed groups, and they are seeing all these programs being implemented without an actual benefit all the time for them. So they don't even have the drive to say to the women, okay, go to your organization, do what you are doing, we are seeing the benefit. It's very rare. So when we are talking about the organizations themselves or the programs implemented in Syria, these organizations, most of them are led by men. The programs for women are designed by men. So basically, the space and mobility and agency for women within these programs, our organizations, is usually very limited. And this is an issue we have been trying to address. I worked in a program where most of the leadership roles were for women, and yet programming for women was an afterthought. It was, during one of the briefings, a white guy sitting in the corner. He wanted to say something useful, and the only thing he could think of, where are the women? Why aren't any women? And you ask them, why didn't you provide proper funding to allow for gender participation? And that was really weird, because it didn't occur to them that gender participation needs proper funding, needs sector experts to work on that, needs gender experts to be involved from the design phase to the implementation phase. So basically, for most of the programs happening now, gender participation is an afterthought. It's something you think of when you have ticked all the other boxes. And even when that happened, they want to leave the burden of women participation on the local level. And women on the local level have been burnt out. They have been drained emotionally, economically. They have absolutely, most of them have nothing left to give. And when we ask donors, when we ask people who are making the decisions, designing the programs, who are working with national and subnational governance levels in every part of Syria, to provide some pressure to ensure that women have quotas, that women are present within these structures they are supporting, they use the issue of sovereignty, Syrian sovereignty, as an excuse that they can't touch Syrian sovereignty. And here we are talking about governments that are supporting armed groups in Syria, supporting the reformation and restructuring of governance, security and justice, health sectors, education sectors, and infrastructure. And when it comes to women, they can't touch the Syrian sovereignty. Mm-hmm. So basically, there isn't any drive or real desire to actually facilitate gender participation on the ground. And there is also the stereotypes and racism in their look at the Syrian women. They expect too little. They expect that there are limits. There are certain things that Syrian women want to achieve, and once they achieve them, that's it. Mm-hmm. Most of the programming having for women is centers for sewing and knitting. And first, it's not a skill. It's not an economic skill that will actually guarantee these women a livelihood. Who would buy all this? Everyone in the same situation. Everyone knows how to knit and sew. So who would buy their produce? No one. We look at those communities. We tell them there are actual serious livelihood opportunities for women. This is how it happens in all other war-torn countries. Women took the lead in the economic side.
Can I just stop you there? I'll come back to you in a minute. Yeah, thank you.
Sorry,
I'm just kind of aware of the time limits. So that's really useful. Security, failed programming, organisations led by men, programming for women's an afterthought, burnout of women's organisations. We know how exhausted we all are. Norms and expectations, low expectations of what women can do, and economic programming that's about keeping women poor. I've never really understood that. Why do we always do economic empowerment that's the least empowering economic opportunities you can even think of, right? So I just want to turn to you now, Rola, and ask you, despite those challenges, women are participating. So how are they participating? What areas are they participating in? And how do the barriers and challenges that Nisreen spoke about manifest in the lives, in what happens to women and men differently? And what happens when women are not actively included as part of the solutions? Sorry, 3 questions. That's not fair. You have to push both.
Both. Morning, can you hear me? So my name is Rola. I'm a Syrian physician. Been working on the humanitarian response in Syria for the last 6 years, all with Syrian-led organizations, and I've recently founded CanDo. So really, I'm sorry you've got a very Syria-heavy panel here, but perhaps seeing as we are the biggest humanitarian catastrophe, you allow us this indulgence. I want to start by telling you a story. And forgive me if you've heard it before. I haven't contracted Alzheimer's. It's a testament of how much we talk about the subject, and yet plus ça change. The story is about an obstetrician, a widow, and an old lady. In North Syria in 2012, I met Dr. Amina, a lovely lady in her late 30s who had just been displaced from Aleppo because of the violence to North Syria by the border. And when I met her, she was delivering women on her kitchen floor, because there were no healthcare facilities left in the area. She said women were just literally knocking on her door, knowing that she has the skill and ability to deliver them, but she had no mechanism of doing it except on her kitchen floor. And one of the days that I went to visit her sat a young lady who had lost her baby because it was prematurely born, and again, no healthcare facilities to care for such babies, so she sat cradling her dead child. In the midst of her grief, she asked me if there were any opportunities for employment with my organization or with any other, because she was also recently widowed and now the head of a household of 15 people, all of elderly and children, and she had no means to get an income. A few weeks later, in the northwest of the country, I met an old lady who reminded me of my grandmother, God rest her soul, you know, where they have those furrows in their face each tells 1,000 stories. She told me about how overnight, with the heavy shelling, she had grabbed the arms of her grandchildren and her daughters and walked over dead bodies for miles until they found this area of refuge where I met them. She was trying to make a home of a bombed and abandoned building with no windows and barely walls and a ceiling, foraging in the local fields in order to try and help to feed them. Women are the humanitarian response. Women are the reason that thousands survive in a crisis. Women are participating in the humanitarian system. They are the reason that many are surviving because of their tenacity, because of their courage, because of their resilience, because of our innate collaboration and cooperation. They are acting at multiple levels, mainly in an informal way, like I've just mentioned, or in the volunteer sector. But this participation is going really unrecognized, it is unappreciated, and it is unsupported. And what I'm going to try and make the case for today is that we will not make a tiny bit of difference on women's participation until we talk about the involvement of the local humanitarians in the humanitarian space. Those issues are intimately linked, they are completely connected, and until we solve the issue of localization of the humanitarian response, we are never going to make a difference to female participation. And the reason is this. Women are participating at the local level, and therefore their interaction is with local humanitarians, whether they are registered groups or whether they are unregistered and informal groups. Local humanitarians are the mainstay of humanitarian response. Those ladies who stood up will know what I'm talking about. Local to Global Protection said that in the Syria context, 75% of the humanitarian work is being done by Syrian NGOs. Can I just see a quick show of hands? Who knew that? 75% of humanitarian work in Syria is being done by Syrian NGOs.
Oh, we have the person who wrote the report.
Amazing. Who is the person who wrote the report? I love you. I've been quoting you everywhere, by the way. I need a commission. 75%. So that's the first shocking statistic, if you like. But the next one is how much funding we get for doing 75% of the work. Less than 1%. Go on, fall over. Less than 1%. Okay, so Oxfam also have said that between 2007 and 2013, this is a global problem, not a Syrian problem. This is the case across the globe in all of the conflicts, all the humanitarian crises, and we have been receiving, as the local groups, less than 2% of the funding. So this is a global humanitarian crisis. That means that at the global level, millions of people are losing their lives because of this lack of localization. And what it means at the local level is that we, the local humanitarians, are not only dealing with all of the issues that Nisreen very eloquently set out. We're not only dealing with this sort of daily care crash and catastrophe of Groundhog Day, of the ongoing war. Not only are we having to deal with a male-dominated society. Not only are we dealing with the extremism and the various other things that are occurring at the level, but this catastrophic shortage of resources simply means it's easier to employ men. So at the humanitarian level, at the local level, in Syria, for example, there are about 2,000 registered and unregistered humanitarian organizations or organizations who are doing some humanitarian work. There are 25 of us women who are head of these organizations only. So if we're talking at a senior participation level, about 25 out of these 2,000. If you're talking about a percentage of the workforce, most of these organizations don't even have 10% of a female quota. Some of them more, some like in the education sector do have more, in the health sector they do have more. But we're talking about a really tiny participation at the recognized or at the formal level, although there is a huge participation, as I was trying to say at the beginning, at this informal level. So what that really means, if I may, just give you a little bit of the sort of the implications of what that is. So the fact that we do not have the resources that we need, yet we are the ones who are doing the work, it means we're having to survive on thin air. We don't even have a shoestring budget. That's a luxury. And like I said, it becomes much easier to employ men because they don't need child-friendly spaces and daycare. They don't need to have remote working. They don't need maternal mat pay. It means that they don't need chaperones because of the poor security problem. They don't need a women-only room because, well, that's what some of the more conservative and religious ladies would like, or that's what the cultural implications of our society is. But the implications I'd like to point out is, firstly, because the locals are not allowed to lead the response and is often led by international colleagues and donor-led, it means that the local needs are not being met. And I don't know if everyone knows in the room, 50% of all maternal mortality occurs in conflict and fragile affected states. So until we let local leaders and those who are actually doing the work lead the response and get the funding, we are never going to make a difference, not only to female participation, but to maternal mortality rate, which is a global health issue. One. The second thing is, because we are not getting the funding, it means we are not able to sustain and we are not able to maintain the services that we are setting up and doing as the local groups. So to give you an example, with my previous organization, Hand in Hand for Syria, I was their medical director. That story was when I was working with them. Those ladies that I met inspired us. We first of all expanded Dr. Amina's house and created a little delivery room and a clinic so that she can actually treat these women in dignity that both her and her patients deserved. And she then inspired us to set up the first and only women and children's hospital in that area, which still stands today. These women are not only doing incredible work, but they're inspirational. The widow inspired us to set up a nurse training program, actually nurse assistant training program. Over 18 months, we trained 120 female nurse assistants in order to provide them with not just training, but employment. But we've had to shut down that service because there was no funding available for it, because we are not getting the resources that we need. So at the local level, we are recognizing and wanting to empower our women, but we are not getting the support. Third thing means that we are not developing our organizations. Syrian organizations are not thriving because we're not getting the resources that we need. And that's not just technical capacity and organizational capacity, but when we have ideas such as, I would love to have a paid work experience or internship for young women, so to get them into the humanitarian space, I have no funding for it. When I want to train my members of staff at a managerial level so that they can become a greater percentage of these 2,000 head of organizations, we have no funding for it. So there's a lack of organizational development. The last 3 points I want to mention is echoing the burnout. I mean, burnout is a huge problem in the humanitarian sector in general, but it is, I would say, everywhere at the local level. All my colleagues are burnt out. All. The number of times I'll be sitting in a meeting and someone would burst into tears or someone would have some sort of fit of anger or rage. It's not because they've gone mad, it's because they're all burnt out. I burnt out twice myself, but I'm lucky because I live in London, so I can extract myself out of this complete shithole and recover and get back on my feet. People, my friends and my colleagues do not have those luxuries. And so there's a really important point that Nisreen mentioned. The lack of daycare, I mean, sounds so simple and so obvious. One of the partners of CanDo introduced a daycare service and a child-friendly space. They now have over 60% of their workforce who are women. Simple measure, by just introducing a child-friendly space and having daycare, they now are getting more and more women applying to work with them. And finally, this lack of resources, often because women are working in the informal or in the volunteer sector, they're not getting a salary. Now, we can all do some voluntary work, and God knows I did it for very many years, but when a crisis continues, you cannot live on free for nothing. You have to start to get remunerated for your work. So just to wrap up, I hope that I've made the case to you guys that I feel that there is so many solutions to female participation, and I look forward to discussing them, but it's so intimately related to the localization of humanitarian response. At the World Humanitarian Summit, they said that one of the grand bargains was by 2020 to be funding, for the funding to be, let me start again, for 25% of the funding to be going to local groups. I say to you that we are woefully off target. We are not on that route at all. I think it's an important target that we should be hitting, and by hitting that, we will be increasing women's participation in the humanitarian space.
Thanks. Thanks, Rola. Sorry I didn't introduce you earlier. That was very rude of me. I apologise for that.
I was trying to look over your paper. I was like,
Yes.
how was she going to introduce
Sorry, that was so rude of me. But I'm going to turn to Howard now. You mentioned that we've had a very focused Syria briefing, and so now we're going to expand that a little bit. And Rola made the great point that women are humanitarians, and just by chance, Howard happens to have written a report called She is a Humanitarian. So thank you, great segue. Howard is the Senior Policy Advisor at CARE International UK and the author of the report I just mentioned. So Rola and Nisreen both mentioned the barriers, that women are still the first responders, that the importance of focusing at the local level, and that their capacity to remain as activists even despite all these things. Are those trends that resonate with you? Is that did you find that in the report, or are there areas of difference if you look globally, or what are some of the kind of more general trends that you saw in the countries you looked at?
Is this on?
Nope.
No.
Oh, do I have to turn mine off?
Okay. Yes, thanks for the introduction. And yes, sadly, so by the way, I should first just give credit. If you can find the She is a Humanitarian report online, and it was the work of, I think, 10 other colleagues actually as well, and I was the one guy on the team, but they couldn't make it here. One of my colleagues, Milka, is here though, from our gender equality team based in the US. So we worked with feminist academics and activists to conduct this research in Jordan and the Philippines, but we also reached out to our staff and partners in other contexts too. So we interviewed just over 300 women working both in local civil society organizations in humanitarian contexts, so both in conflict and in natural disasters, as well as in UN agencies, government institutions, and other international bodies. There were kind of 4 main themes that came out, some of which very much resonated with the experience that we heard about from Syria. So I'll just share those, the kind of 4 problems, and then 4 suggestions on how to fix the UN system in terms of women's participation in addressing gender on humanitarian. So the first, as we've heard, is that there's still this tendency to see women just as victims or passive beneficiaries of humanitarian assistance, and to not recognize the agency of women and how local women's groups are playing a role in humanitarian assistance and protection. And this is even reflected in the actual structure of the system. So while at the global level, you have the humanitarian system, within the system you have the gender reference group, within the interagency standing committee that sets certain standards on humanitarian action. This is very far from the operations on the ground. And then on the ground, you have this system called the cluster system, where within that, you only have within the protection cluster a gender-based violence focused sub-working group. So a lot of the effort at the national level tends to be skewed towards this focus on GBV. There have been efforts to get beyond this with establishing gender working groups at national level and focal point networks that connect to the different sector working groups on gender, but those efforts, you could say, are more nascent and have made less progress so far. Secondly, the accountability for gender in humanitarian action still remains largely a kind of a tick box exercise focused on internal processes within humanitarian agencies, and also just at the proposal stage of writing a proposal to a donor. There's the kind of this box within the proposal which says how in theory the project will try and address gender, but there isn't the follow-up to actually then evaluate, well, you know, was that analysis applied, and did outcomes sort of improve either for women and girls or men and boys from a gender perspective. Also, that accountability still remains stuck largely at the project level, not organizational or interagency level. Again, we need to recognize that there have been efforts to address this, but they've not made enough progress. So, for example, in Jordan, but also in the Philippines, we heard about this, that there was even a working group set up to address prevention of sexual exploitation and abuse of refugees in Jordan or displaced people in the Philippines, but very few staff knew about that process and or how to then refer cases when they occurred, and there hadn't yet been a rollout of any training to staff on that at the time at which we did the research. And more importantly, we heard from people in the affected communities, both men and women, boys and girls, that a sort of fear that if they raise any concerns, criticisms about what's provided or not provided to them, let alone if there's some sort of gender-based violence type of incident or dynamic playing out, that there would be negative repercussions for them. And in Jordan, fears of even being forcibly moved either from an urban area to a camp or even forcibly returned to Syria. And then fourth, this point around a lack of female support for female staff at all levels. And we heard about this in the breakout session yesterday. People were referring to lack of maternity cover policy. We heard about the sort of crash and other facilities. So in terms of actions to address these, we need specific commitments on addressing gender in a holistic way, as well as specifically women's participation, factoring in GBV as well, and sexual reproductive health and rights, but also from this kind of more agency-centered approach at all levels of humanitarian responses, and as well as support to local women's groups in delivering on that. And as Rola mentioned, there is this opportunity with the Grand Bargain, this initiative out of the World Humanitarian Summit, to support localization. But I think a problem here is that we need to recognize that an unnuanced localization could mean a lot of the funding is getting captured by essentially male-dominated national NGOs. I mean, when I think about in Syria, we have, you know, of those 25 women-headed NGOs, how many of them are also practicing, you know, beyond having a female figurehead, actually really being rigorous around issues like sexual exploitation of people that receive assistance from them, or other gender concerns? I don't know. So we don't just need to see that percentage going to local organizations, we need a gender lens within that and specific support going to the kind of feminist-minded local organizations as well, which isn't really happening at the moment. And then on accountability, the shift from measuring internal processes to rather really being held accountable across the whole cycle of programming for can women and girls actually better access assistance and protection or not? Not does it say so in a proposal document. And I think the excuse that is used is that, well, in a rapid onset emergency, you can't run a 6-month consultation process because people are dying and they need assistance now. And to be honest, that is a fair point in a tsunami or in a rapid onset crisis, and that gets lost by some of the feminist critiques of humanitarian action. But most crises aren't just rapid. You know, all of these crises we're talking about have been going on for years, some of them for decades. So that excuse can't hold anymore, and we need to challenge it. And then lastly, lack of female staff and sort of the organizational culture. Well, appoint female staff at all levels and make that a funding, you know, factor that into funding, particularly this sort of multi-year funding that has now also been a commitment under the ground bargain. I'll end there, but I do want to come back, if there's a chance, to some of the points that were made about INGOs yesterday, because I think there were some really strong, valid criticisms of how INGOs do or don't partner with local organisations, and we can talk more about that, as well as on this localisation and the neutrality point, because I think there's a really interesting, how do women's rights organisations relate to humanitarian organisations and this issue of neutrality? International humanitarian law implies accountability for violence against civilians. So, and human rights and protection is a part of that. So rights is a part of humanitarian action. Yet, that said, though, if different groups are only calling out one perpetrator and not others, then that's also not honest from a human rights perspective, and it makes it hard for organizations that are trying to work on the ground and negotiate access if they're perceived as basically aligned with one side, party to the conflict. So that's one nexus. And then on localization, we need to get away from the local good, international bad. I mean, in both the Philippines and the Jordan, and in every other context I've worked, the main thing I hear about first is criticisms of local CSOs, and that, if in humanitarian crises are by definition involving national institutions either being contested or in conflict or even collapsing, then there's a lack of there's not clear structure for accountability for rights violations. So somehow how we use international mechanisms within the UN or international agencies as well, who also face challenges in terms of their accountability, as I mentioned, in terms of prevention of sexual exploitation and abuse, for example. So we need to, there's good and bad in terms of both local actors and international, and we need, from a women's rights and participation perspective, we need to address both in an honest way. Thanks.
Thanks, that was actually great because you kind of moved us to start looking at what are some of the solutions, and you talked about this need for real accountability beyond like ticking boxes, which we see constantly, the need to include women, female staff at all levels, and I'm kind of mindful that Caitlin was here yesterday. I can't see, I don't have my glasses on. And she's working on, that's an area that the gender champions are working on. You referred to stronger use of international legal mechanisms and creating these strong partnerships between local organisations and INGOs rather than setting them up as being automatically in conflict, either INGOs bad, local NGOs good, or local NGOs not competent, INGOs having all the skill, both of those constructs being, well, completely wrong really, because they only tell part of each story in a different context. So if we were to move from those kind of potential solutions or ways of changing our work and looking at things slightly differently, Nisreen, how have women in Syria been working, say, particularly in the field of governance, despite the ongoing conflict, to kind of build women's movement, and what kind of vision do they have for rebuilding the country?
So first, why we are focusing on governance and service delivery. From experience, I realized if women are not present in the local councils, in the service offices, they won't get services. There were communities now in Syria, areas that are controlled by people with Islamist leanings. You can't talk about birth control. And we have struggled to create maternity clinics because we worked within a program structure that prioritized local need assessment, that we needed local backing for each project. And when women in certain communities suggested a maternity clinic, men unanimously objected to that project. And these are men who would never allow their women to use any form of birth control. Yet they don't want them to get the support. They don't think it's a priority. You keep hearing, it's a war, we have other priorities, we need this, we need that. But the things needed by women are never a priority. It's always a luxury. So that's why we need women there. What is being done by women organizations and other organizations to ensure that? First, we have a movement toward training on project management, proposal writing, financial management, things that are needed within the local council and still missing. There are 400, last October, there were 460 local councils in Syria. Most of them have serious issues in capacity, especially in the financial side. So there are more training and capacity building for women in that regard to ensure that they have better chances in competition for a place in the local council. Other groups like Marseille's Kishmalik, now they are doing a very amazing project, which is training women for a year on issues related to managing service delivery and governance, such as financial management, project management, etc., training them for a year, and then asking local councils to give them a place, to give them a position within the local council, and they will pay the salaries. Because sadly, as we said, donors don't support. They want women to be in the local councils. They do not do anything for that to happen. They would never pay stipends for anyone in the local councils. So this is a gap is being filled by the local councils, and that we have to emphasize here that there isn't enough funding for such initiatives. So this is just one initiative I heard of. And a group in Idlib, a women group in Idlib, they had a campaign for enforcing a quota in the local council for women, at least a 10% quota. It's a small effort, but at least they started something. There are women groups that are working with allies within the local councils to create women offices. So usually within the structure of the local council, they say women don't have the capacity, they don't have the experience, they will be a security burden. So the idea of creating a women office that look at the needs of the women within the community, in the service department, education, health, and education for their children. So they are creating a segue to ensure the presence of women in local councils. So that's what women are doing, women organizations and Syrian organizations are doing, but we also need more support. We need more pressure on Syrian governance and service delivery structures to have quotas for women. We need pressure from donors on any project that is, now that they are changing direction to service delivery rather than supporting local governance structure. So we need to have a gendered approach to that. We can't overlook the needs of the women, and we can't expect local women to do all the work to ensure their participation. So women organizations, activists, human rights organizations should focus more on advocacy for more political representation and more representation of women in political entities, governance structures, and service delivery structures. If we are to talk about the vision for rebuilding the country, women organizations, sadly, because of the situation and the funding streams, have been focused more on service delivery and humanitarian support rather than on developing their political feminist vision for the future of the country. So there are few of them that are still focusing on that side of things, but sadly, it's still a minority. So before talking about what's their vision for rebuilding the country, we need to make sure that they have a space to have that kind of vision. They have core funding, they have support. They are part of the political process, because you can't be a small group working on providing support for IDPs in a camp or a local village, and then expect them also to form a political vision or a vision for rebuilding the country. The whole issue is not even discussed yet. It's still a donors or foreign countries or supporters issue. This kind of discussion is not, Syrians are not part of it, let alone Syrian women. So basically, we need first to create the environment where women can develop such vision and then ask about it. Thank you.
Thanks. That's a really great start for thinking about. So we've had a little bit about what are the kind of more multilateral solutions, some ideas about the local solutions, about increasing women's representation in local councils, providing salaries so that they can participate, creating an office of I don't know, women's affairs, putting pressure and advocacy on the Syrian government and on Syrian authorities to have quotas, a gendered approach to service delivery, which is also something Howard mentioned, and then focus on creating spaces for feminist activism to have the ability to be able to vision for a future, which kind of, after having heard both of you talk about burnout, you kind of wonder how do you create a space for people who are, you know, already so drained by all of these responsibilities that you've just spoken about, just to be able to think and vision. So it's a really becomes a difficult challenge. So what do you think are the strategies, Rola, for opening more spaces to give women that voice that Nisreen's talked about, and to have those experiences and their knowledge and skills acknowledged and then brought into a more kind of holistic approach for the future?
Yeah, excellent question. And I think, you all know what I'm going to say. For me, it really starts with putting the resources at the front lines in local hands, with the people who are doing the work. But before I carry on, I want to address Howard's very important point. I think one of the things that has paralyzed this issue is this mistaken and sometimes venomous discussion about good and bad locals, good or INGO is bad. It isn't about that. It is that we are very, very different in experience and expertise and knowledge that we have, and it's somehow turned into this sort of fierce competition of who's better than who, rather than going, you know what, you locals know the context. You know what's culturally appropriate. You know what the needs are. You know how to best get A to B in the safest way, most cost-efficient way as well. But you know what? We've been around for decades. We're really good at what we do. So this is about, for me, the international NGOs and some of the bilateral and multilateral agencies, they need to change their architecture and they need to change their role. They need to be big brother and sister to the local organizations, and so there needs to be much more of a real and a meaningful partnership that allows us to lead, that gives us the appropriate resources, but by being there with the support. So for me, localization isn't about let's skill the INGOs, although I do have those days. But it's very much about the sort of we need to reimagine this and put the structure, a different structure there. And I think. So funding is obviously a big part of that, and let's not joke about that, but there is beyond funding, right? So there is the necessary organizational development that I talked about. So that's partly in the technical issues. That's partly at the organizational kind of development level, so financial management, etc. But it's also the training in the cross-cutting issues such as gender, so that these things are really important part of the capacity building. I'd like to, I said that with the grand bargain, I think we're off target, and at CanDo we are trying to start a movement that empowers local organizations. We're building the first crowdfunding and crowdsourcing humanitarian platform so that we can harness the giving, the care, and contributions of people from around the world and channel them to local organizations working in conflict zones. So the idea is that if you are a local organization working for a health-related project in a conflict zone, you can apply to be a partner with CanDo, and then you can apply to get your projects funded on this internet platform. So that you can get the resources that you need for your programmatic funding as well as for your core funding. But I think, again, going back to Howard's point, this is not just about money, and we need to keep in mind these other issues. And so what we also do is an organizational development program or a capacity building. I hate that word. We need to find a better way of saying it. But technical assistance on certain issues such as fundraising, such as communications, such as impact assessment. Because I think one of the criticisms or issues is that there is no data that backs up the impact that we have on the ground and that we make on the ground as local organizations. And data is really important. So we're working with our partners to support that. And one of the fundamental criteria for an organization to become a partner with CanDo is what we call human-centered design or participatory design. You have to show us that the project or the program that you want to apply for funding has been designed or co-created with the affected community. So that is our way of putting that participatory lens on it. And I want to just somewhat challenge what you said about maybe focusing on feminist-led organizations. Our current 4 partners, only one of whom is led by women. Actually, one wants to do a psychosocial program for gender violence survivors. One is a mental health care program for women. In fact, 3 out of the 4 programs are aimed at women, but only one of those organizations is headed by a woman. So I think, again, going back to that point, that when we are given the space, when we are given the resources, when we're given this ability to get what we need, I think that you'll be surprised with how much people are thinking about women's participation and including them. I'd like to just end on the caveat of localization, and that is that obviously we're not talking just about NGOs, but government entities and governments. The role of the United Nations is to hold governments accountable. And when governments are complicit in the humanitarian crisis, or they have generated a humanitarian crisis to continue to direct and channel aid through that criminal arm, is severely hampering the humanitarian services and the humanitarian delivery and the localization. So that is why we need the United Nations to partner up with more local and national groups, and very importantly, to hold accountable on the protection and assistance issues, so that it can be the organization that we all hope and dream and wish it will be.
Yeah.
Sorry, I'm very aware of our time constraints. Are we allowed to have 10 more minutes since we started 20 minutes late? Sorry? Oh, okay, good. Okay, no, I'm not so stressed. That's great. Thank you. Thanks, Rola. You said, I like the way you said reimagining how things could be different. I know Laila is the crisis response manager at WILPF, and I know, Laila, you wanted to talk a bit about when the humanitarian system is being inclusive, who does it include, but I kind of feel a bit like Howard covered that. So maybe, what strikes me here is there have been these UN reforms, there's been the World Humanitarian Summit, there's been all this thought about how we could improve things, but arguably it's just been kind of tinkering at the edges of a masculine construction and measures and identifying the goals to redress imbalance rather than a real shake-up. And I wonder if we've reached the limits of the progress we can make within this very patriarchal, static order. And maybe it's time to kind of reflect on a new feminist vision that goes beyond the kind of current agenda to one that builds on the lessons that have been learned, forges these alliances that the 3 of you have spoken about, and starts to look at more a progressive agenda that reimagines what it could look like in a kind of patriarchal society, and I know that sounds a bit utopian. But so can you tell us, your thoughts about that? Not should we smash the whole system, but is there something we can do to disrupt the way the current system's operating? And can you tell us about how WILPF and your partners' strategy for a new agenda to bring women's voices more centrally to improve the humanitarian response?
Sure. Thank you, Catherine. I think we should smash the whole system, but that's what we do. You see this?
Laila, you
sorry.
need to.
Yeah. Can you hear me now? Yes. Yeah. So, have you seen when Catherine asked at the beginning about are you working within a humanitarian development section to empower the participation of women, how most of you had a moment of hesitation? Because those categories of, I don't think the hesitation was, do we support the participation of women or not? I think the hesitation was, is it within humanitarian development sectors? And I had my moment of hesitation. A few weeks ago, I was speaking to my brother, who is a humanitarian as well, and I told him, but I'm not a humanitarian practitioner. And he said, well, you have to wait here. What is the humanitarian you're speaking about? And I said, well, the humanitarian aid, which is providing, as the multilateral system defines it, it's providing material or logistical support for people who are in crisis. And he said, well, you should see how MSF, where he works, defines humanitarian aid, which is providing assistance to people in crisis. And if you think you don't do that, then I don't know who does. And yes, we provide assistance to people in crisis, and that's what our partners do as well. And we have been, our space has been limited by a narrow definition of humanitarian assistance, and this narrow definition has had so much impact on the ground that is marginalizing women groups. And I argue that is limiting the feminist identity of organizations that we're working with. And that takes me to Howard's point that we see in the conflict we work in in a very amplified way. The current humanitarian system, led by the multilateral system and their operational arms, is dealing with armed conflicts where we work in the same way they deal with natural disasters. It's exactly the example you said and exactly what we spoke about yesterday. They deal with it as a tsunami. And that means, obviously that means rapid response and having to respond to what people need, but it also means two things that harm us on the long run. It means that there's no time to consult the local community because there's a tsunami and we need to just move quickly or everyone will die. And it also means that they set the standards so low that everything we work on counts as a luxury, both very wrong. In Yemen, in Libya, and Syria, and other places we work in, there's a generation now who are in middle school and remember nothing but this armed conflict. There has been so many actors working on this, there's no excuse to still use the argument of rapid, quick response where there's no space for things. And that argument also allows them to reaffirm the patriarchal structure that is there. When they look at this conflict as something that needs quick, rapid response, we need to do it now. They go to the most powerful person in that town or village, and who has been the patriarch will continue to be. They will continue to use the same ways, and they collaborate with, ask to develop the alternative, what was supposed to be an alternative mean, and is now a replication of what has been the case before. It also forgets something really important at the heart of the political economy of the conflict. The humanitarian aid is no longer a little bit of assistance that's made for a quick, short-term, high-intensity thing. It's a long-term. There's a merge between the humanitarian assistance and the development. It's half of the economy. It's a big part of the economy, and unfortunately, the other part is war economy, which we don't want anybody to participate in. We need to stop. It's based on the trade, production and trade of arms. It's based on the control of areas and mainly on killing people. And we need that to stop. So the only option is to work on the other part, which is what is now the humanitarian assistance. We need it to be inclusive, because there's no excuse for it not to be inclusive. And by that, I don't mean those women-led organizations who have been forced into service delivery to create constituency and to be able to exist within humanitarian definition. I mean also the organizations that Nisreen mentioned, the organizations who chose a very brave feminist identity in some of the worst, most challenging circumstances. These need to survive in order for this political economy map to change, in order for the currently small, narrow humanitarian assistance to be developed into an economy of development, of inclusion, and one that also works for women, because now it doesn't, and also to limit the other bit of economy, which is based on arming and violence and armed groups, all of them. Some of them governments, some of them non-state actors, but all of them have the exact same measures, and they treat women exactly the same. So what I'm trying to say, my colleagues have put the issues of how we do this perfectly. There's nothing I can add to this. What I need to add is two things. In order for the humanitarian system, as we know it now, to work for women, we need it to involve, to be inclusive of organizations who have chosen a feminist identity the way they chose it, not by them having to deliver services. If they chose to deliver services to create constituency, then great, they need to be supported to do it. And if they chose to do it in any other mean, they still need to be supported within the humanitarian cluster, not as something parallel that we always drop because there isn't enough money. It's at the heart of the humanitarian assistance. And the second thing, it's these organizations who are challenging militarization and armament and the trade of arms and the funding of violence, which is funny enough. I'm going to quote you, Rasha. Rasha said to in an event at the British Parliament where they said, funding arms that is killing people in Yemen is an internal economic British issue. And she told them, well, in this case, you have to take into consideration when you're doing your humanitarian assistance and when you're saying you're the champions of peace, the blood of people who have been killed by these very arms. This is at the core of what feminist organizations we're working with are doing. The issue of arms trade and the issue of supporting violence is at the heart of preventing peace. They're not two parallel issues. They're one single issue and can only be dealt with in one way. And they are dealing with while taking everybody into consideration, and they have to be involved within this humanitarian response to change this plan, to change this map, and to actually create a development that works for everyone. Thank you.
Thank you, Laila. I'm really sorry, we only have 10 minutes for questions, and people already have their hands up. And I also wanted to know, is it possible technically, whoever's in charge of that, for us to have questions from the people watching via streaming? Mary, we can? Okay. Okay, but I'll start with a question from the floor, since that'll be technically easier for me. And could we, I understand you'll have questions for the panelists, and there's plenty of time during the day if they're really just questions about their intervention, but if you could really focus on what are some of the solutions you would like to contribute, I think that would be really helpful, particularly as we move into the next session, which looks at this kind of continuum. So can I start with you? Thank you.
Hello. I have like 2 to 3 recommendations. First, we should start to design programs for people like us, not to the other women. We tend to be in the seat while we are designing to the other women, sewing, knitting, literacy programs, forgetting that participation need to design training that we would love to attend. That I am, as a Syrian woman who lived my whole life in Syria, would love to attend such a training. Because this otherness for the trainings is not helping participation. It's creating like 2 levels of we are designing to help those mass majorities of beneficiaries, and we are obsessed about numbers, we want more numbers. Second, we need to use the term participation in the humanitarian. It's not there. There is protection and empowerment, and both of them doesn't lead to participation. they lead to protection and empowerment. So we need to use the term more. And the third recommendation, let's work after the participation. We have 2% in Syria for local council, 5% on the head of civil society. Who work with this 2% and 5%? After the participation, those are left alone to burn out, to be a bad example of participation. Look how angry they are, look how burned out they are, they don't know how to manage. We need to work of those two, because if we lose the 2%, no matter how much we are focusing on the 98, we are not increasing the number. And we need to do more global naming and shaming approach. Let's name those who are not giving us maternity leave. Let's create a website where every local organization can go in and say, we talked to this INGO, and this INGO said no for maternity leave, said no for daycare. Let us a bit be outspoken globally, because it's the same exact behavior everywhere. And if we created such mechanisms right now, it's gonna be really helpful in the future. And they're gonna be scared of us. They are scary already. They're gonna be scared from us, and they're gonna change. And I'm taking change because they are scared from such a website as a good thing. It's a beginning. Later on, gonna be in the policies. Later on, gonna be in structure. Fifth, we need to create a global sisterhood mechanism. This 5% from Syria need to know the 5% from Yemen. We need to know those who are doing Women March in. Without the global sisterhood, we are having too much in burden. I'm become the activist. I used to be this Syrian activist. Right now I have 250 employees. And meanwhile, everyone wants me to know how to deal with everything. INGOs, Secretary Kerry, Demistura, the team members who are like mostly male, to train the next female CEOs. Like, I can't. That's so simple. I can't. But maybe with global sisterhood, with like mentorship, coaching, with creating circles, I'm able to do half of it properly. Thank you.
Hello. Yes. Hi. Thank you, Laila and Nisreen and the whole panel. It was amazing. I'm Rasha. I'm from Yemen, and I've been working on the humanitarian sector for a couple of years. Not so recently. I shifted to gender issues more and development. But before that, I worked in the Syrian context and Yemen context. Unfortunately, if I give examples, what you were talking about localization, that's a very valid point. Not only localization, we need also flexibility of the response. Because, for example, in Yemen, we have areas which are post-conflict, areas which are still ongoing conflict, and pre-conflict, I would say, and I hope not. But so in areas, for example, the humanitarian response right now focuses its response 70% in north areas and neglects the south areas. The south needs more recovery. I have my friend here who is running psychosocial support services to women. The legal system is collapsing. Women cannot, as simple as getting a divorce or and cases and the judiciary system, they cannot go. But the system rather go and support the short-sighted remedies, such as those boxes for ladies. They call them dignity kits, which is, I think, the opposite of the dignity word. The response also, yesterday I gave an example about DDR programs and how my friend was also dealing with children who were recruited and combatants. The plan for Yemen last year actually suspended DDR programs. They said in their plan, the UN plan, it was that it is risky, or for security reasons, they do not want to do demobilization and disarmament and reintegration programs, and waiting for political settlement. The plan, when it is developed, it lacks the inclusivity. They do not include women, and they don't hear women what they tell them and what they need. For example, when we interviewed the internally displaced persons, women, they said their number one priority is livelihoods and income generation. Yet, the plan last year dedicated only 3% of the response to that. So we have a plan that is not funded. It's not even, they don't ever meet the pledges, that is not inclusive when it is being designed, that lacks the accountability, as Howard also said, and that doesn't deal with the meaning of a protracted crisis. I had an option to be in this meeting with WILPF or to go to the Yemeni humanitarian conference, which happened before yesterday. I chose to be here because when I voiced this opinion to UN official, the UN official told me this kind of language is not right for this kind of conference. And he didn't even listen to me. So thank you.
Microphone, please. Microphone.
You've got one?
No, microphone.
Speak.
Okay, you've got it. Okay, yes. Okay. Are there any more questions, comments from the floor? Just one more, I think we can manage. Katharina.
Okay, my name is Gorana Manarovic, coming from Sarajevo. I kind of feel responsible here because we are in Europe and talking about there are two things. First is humanitarian issues, and for this panel. The second is reclaiming UN. Given the situation in Europe with respect to refugees, we are actually silenced here, and I really need to bring it up. Second thing is what we see from the response in Europe as regards to supporting refugees is the question of we now don't have, and we don't talk about civil society as such, but we are talking quite significantly about informal groups. So we need to bring in discussions informal groups which are more effective on the ground than are any sort of formal groups, and not to mention UN agencies. And what we learn from the ground on the ground with respect to UN agencies is that they are actually creating more obstacles than any kind of support. And that leads us to questioning whether we can not just talk, when we talk about UN, we really have to pay attention to question whether we want agencies to exist anymore, or how can we reclaim them and reform them, because significant amount of the resources are going to the UN agencies, and what we see in the field is actually them making obstacles rather than anything. And I mean, I do want to point out that 3 years now, we see how UN agencies actually spend more money on promotional and PR activities and media activities than actually supporting people on the ground. So that's.
Thanks, Gorana, good point. And thank you for reminding us of our responsibility sitting here in Europe to talk about the challenges that we should really be managing. Yes, thank you. We've run out of time. I'm really sorry. We've run out of time. So I don't want to go into Elizabeth's panel's time. So instead I'm not going to wrap up because you don't want to hear from me. So I'm going to just ask each of you instead as a wrap-up point to give us your top, what you take away from this panel as the top 2 recommendations for how we can improve the process. So, and I'm going to just go this way and start with Howard because you had the least floor, and if you'd like to do 3, you can because you spoke the least.
Okay, perhaps just 3 ideas for how we could collaborate then going forward. And also trying to address the points that were raised also yesterday, not just in terms of the UN, but INGOs either occupying space that local organizations should have access to or lacking solidarity, I heard as one theme. And secondly, capturing the funding or somehow not enabling the funding to come down to local. So trying to address those. So on the solidarity and the kind of support to local organizations engaging at different levels and having influence, I think what we need is a longer term approach. In fact, INGOs are struggling to engage with UN systems as, well, maybe no, not as much as local organisations, but we are also, and we need a longer term. We're always on the reactive, and so, for example, in terms of Syria now, with the Brussels conference that just happened, actually myself and I know other INGO colleagues worked through the night for weeks running up to it, trying to get local partners into it, and we succeeded with some, using influence at the most senior levels of Mogherini's office in the EU and the de Mistura team in the UN to try and make that happen. The 5 INGO chief executives that flew just to come into the main summit didn't go in. They sat in a side room to watch it on the telly and gave up their spaces so Syrian partner organizations went into the actual summit, which I don't know if that's actually known outside of the individuals that were involved in that. But we need to not just be reactive, let's plan. So every country in conflict has an NGO forum. There must be at least one ally to your networks amongst those. So let's plan and link up and work out how to do that longer term, as well as on a sector basis. You know, we struggle because the humanitarian system thinks in terms of sectors, and we need to break that down. But like, what's the most strategic sector in terms of exploitation of women, failure, lack of women's participation? Let's identify that and work longer term to kind of involve feminist organizations in challenging humanitarian groups on their gender analysis, on exploitation of women, on women's participation. Please come and talk to me, and let's work on this in the afternoon session. And then on the funding point, the grand bargain that we heard about out of the World Humanitarian Summit, I think let's come up with a plan for how to make sure that those commitments to get funding to local organizations doesn't just go to the male-dominated ones, but reaches either male or women-led ones that are trying to address gender issues or rights issues in a more holistic way that, again, may not fit the classic, water sanitation or food tick box, sectoral box, but are doing amazing, awesome work.
Thank you.
So I think the priority now is
Microphone, please.
Sorry.
Thank you.
This one. I think the priority now, from my perspective, is to ensure that the design of development policies, economic policies for countries like Syria, Iraq, Yemen, Sudan, Libya is not happening in Washington or London or Paris. It should be in the local level. And to ensure that, no one would give us that. We have to create alliances. We have to create local and regional alliances to make sure that the design is happening on the ground, or with participation from people on the ground. We need feminist groups, we need feminist organizations and network to actually create alliances on the ground, to create this impetus for more pressure for their participation. Feminism, sadly, is still a bad word in our world, in our region. So we need to have alliances with other groups who have maybe different approaches, but they are keen on women participation and women empowerment. Something that Marcel mentioned yesterday, that we need men as our allies. We need men, service delivery, people in education as our allies. We need to make everyone understand that economic policies and development policies that disregard women are extremely harmful on the long run. It might be satisfying now, it might be okay now, but on the long run, it's extremely harmful. Thank you.
Thank you. Great.
I think the first thing that we need to do is touching upon your point and the point that Gorana made, and is to reimagine who is a humanitarian, and the fact that actually we need to be putting our hands together and making this sort of collaboration and coming together of like-minded organizations, people and spirits, which is civil society, which is human rights organizations, which is humanitarian organizations, as well as informal groups. So I think there needs to be this sort of much more coming together and breaking down of these sort of false barriers and false distinctions which do not reflect to people on the ground locally. So I think that big movement together, and this movement all working towards supporting and sustaining and developing the local-led initiatives in these various areas of crises, which is through funding as well as some of the other resources. So I think a localization movement and a coming together of like-minded people from around the world, and I'm excited. Let's do it.
Let's do it. I think two very important things to do at this point is to challenge when good concepts go wrong. Concept like the neutrality of the humanitarian space, when it means disregarding the root causes of what made this humanitarian action needed. Very much like the neutrality and the depoliticization of the peace work and of feminism. Feminism is political. Forcing feminist movement to be unpoliticized in the humanitarian space and in the conflict space is not working. It's political and it's an opinion, and that needs to be reaffirmed, and any attempt to change it should be challenged. And peace work is political. Peace work is not about not having any opinions. It's about having the opinions and the ability to identify root causes of conflict, stop them, and arrive to peace that includes everyone, and everyone with their space to have their political views, including the feminist movement. Thank you.
So thank you all very much. I think that actually is a great kind of summary of what we can take away and actually take into the next panel. Thank you very much, Howard, Nisreen, Rola, and Laila. It was really great to work with you. And I'm going to hand over now to Lisa Prugel, but just so you know, you can go out and quickly have a coffee. It's not a coffee break, but there's coffee and snacks outside, so you can briefly rush out, bring your coffee back in. But, oh, you can't bring your coffee back in? Oh my gosh, so briefly rush out, guzzle your coffee as fast as you possibly can. But please, please don't take a long time and chat, because we don't want to take time out of the next panel, which is a really important development for the next phase. Thank you.